Hey everyone, Chloe Banning here, PA with Mangat Plastic Surgery Institute and Skincare in Avon, Colorado. I am an aesthetic physician assistant, so that means I spend my days doing cosmetic injectables such as Botox and filler. Today I want to do a deep dive into Botox. Many of us know about Botox, maybe have even had it done before, but not a lot of us know the science behind it and all the places that we can actually use Botox treatments. So today I want you to get a little bit more information and I hope you learned something. So let's jump right into it. Botox, the name Botox comes from the words botulinum toxin. It's actually produced by a bacteria, and how it works is it inhibits the communication between our nerves and our muscles. Normally, our nerves tell our muscles to contract, but when Botox is introduced, it actually inhibits that communication. Now, long before we used it for cosmetic purposes, the medical community knew about botulinum toxin because it's actually the compound that causes botulism. Now, that sounds really scary, I know, and botulism is a severe illness, but Botox Cosmetic is very, very safe. We use the product in tiny little doses, and it's very, very highly and heavily regulated. So I want to assure you that Botox for cosmetic purposes is a very safe treatment. Botox is a brand name for the product that we use when we do these treatments. There are other types of brands as well. You may have heard of Dysport, Xeomin, and Jeuveau. They are all used for the same purpose. Now, we often use the term Botox to describe these treatments generically. We all know what we're talking about when we say Botox. It's kind of like Kleenex. When we say Kleenex, we know we're talking about tissues. So for the purpose of this lecture, I'll just say Botox and just kind of use it as the generic term. Now, Botox has been used for over 30 years. First, we used it for more therapeutic or medical uses, such as to treat urinary incontinence, muscle disorders, or strabismus. It wasn't until 2002 when some savvy scientists decided to then use it for cosmetic purposes. So let's think about what Botox treats. We use it to improve wrinkles. We often think of the lines created on the upper part of our face when we plan a Botox treatment. Now, full disclosure, I do have these products in my face right now, so I'm going to show you some of the areas where we treat, but I don't have full muscle movement because the treatment has been effective. So Botox is approved for use for these lines right here, the glabellar lines. Sometimes we call these the 11s because they are vertical right here on our forehead. We can use the Botox products to relax the muscle here and improve these lines. I can also use it on the forehead. So for these lines, when we raise our eyebrows up and get these horizontal forehead lines, I can treat those with Botox as well. The third most common area where we use Botox is the crow's feet, or these lines around the eyes that appear when you smile. So when I inject it into this area, those lines are going to be relaxed. We often use Botox in other areas of the face as well. Now, these are more specialized treatments, and I always evaluate my patients to see if these might be of benefit to them. One popular area is what we call the brow lift. So sometimes I'll put a little bit of a Botox product just to the lateral portion of the brow, and that helps to relax this muscle that pulls your brow down, and the result would be then a little bit of a brow lift. We also can use the Botox products to help relax what we call the bunny lines. These are the lines that are created by the muscle called the nasalis. So if you scrunch your nose up like this, you get these little lines here, and those we call the bunny lines. We would treat these for people who get those kind of when they smile, so it might be a natural thing to pull this muscle up, and I can relax that. Also, people sometimes get a little bit of a gum line showing when they smile. We call that the gummy smile, and I can relax your lip elevators to prevent that. Another area where we often use a little Botox is on the upper lip. We like to call this the lip flip or the lip pop. It's a nice little treatment just to give you a little bit more of that pink of your lip. It also helps to prevent the vertical lip lines, these ones here, from getting deeper. So this big muscle around our jaw here is called the masseter. And if you bite down, you can feel it. Some people it's a lot stronger than others. And I can use Botox here to relax that muscle. that has a couple purposes. One, it can help with TMJ or teeth grinding, which I'll go into more in a second, but it also cosmetically can help to slim the face. Over time, after doing a series of Botox injections, that muscle actually atrophies, and so you get a slimming of the face. This muscle here is called the mentalis, and some people get a little bit of dimpling or an orange peel look, and so I can soften that muscle here so that your chin looks nice and smooth. I love treating a muscle called the depressor anguli oris, or the DAO. That muscle makes this face, so when you downturn the corners of your mouth, you get this pull. So I like to treat this more preventatively. It helps to prevent the downturn of your corners of the mouth and the pull that you get there from that muscle. The neck can actually be treated with Botox as well. Some people have lines from their platysmal bands that stick out. Mine aren't very strong, but I kind of have them to the side. So you can treat those bands and actually soften the neck. When we do that treatment along with that DAO that I was talking about, we call it the Nefertiti lift, and it helps to give you a more defined jawline. Now, people are often using Botox in small doses as well. We call this microtoxin or microbotox, and this treatment is where we only use a small number of units diluted down, and we can spread it over larger areas like the neck or the chest. How this works is it loosens that connection a little bit between the skin and the muscle, and it actually helps to improve your skin texture and tone. So it's a nice treatment. I want to talk a little bit more about the therapeutic uses for Botox. So as I mentioned, we can use Botox to treat the muscle called the masseter, and that's going to improve TMJ, grinding of your teeth, even headaches. There are some other muscles in the face that are specific to treating headaches as well, and I do those treatments here in our office. There is a medical condition called hyperhidrosis, which means excessive sweating, and we can use Botox to treat this. So whether you sweat excessively in your armpits or your hands, even your feet, we can treat those areas and you will get greatly reduced sweating in those areas for about 4 to 6 months. I love doing this treatment because it really improves quality of life in the people that are affected by hyperhidrosis. So let's talk about the treatment. So I use teeny tiny little needles, so you feel little pokes, but it's very comfortable. And if you have a needle phobia or you're really concerned, I'm happy to use a little numbing cream on you before our treatment. But most of the time, we don't use any numbing, and it's a very tolerable procedure. Now, let's talk about a couple of the common side effects. These mostly have to do with the fact that we're using a little needle and putting it into the skin. So, of course, anytime you do this, there's always a risk of a little bit of bruising or swelling. Now, if you do get a bruise, we have a laser here at our office that we can use to help treat that bruise. So, it's always complimentary. You can come in the next day and I can give that bruise a little zap, and it's actually going to heal faster than if you would have just left it be on its own. Some other side effects, sometimes people get a little bit of headaches. Those tend to go away, especially because, like I mentioned, we use Botox to treat headaches. One side effect that patients are often scared of is getting a brow drop or an eyelid drop. In medical terms, we call this ptosis. Now, a brow drop or a heavy brow, that's due to the forehead being treated too heavily. Now, I always evaluate my patients and make sure that I treat them with the appropriate amount of units so that they don't get that heavy brow. But if that does occur, of course, it's going to fade away as the treatment goes away as well. Now, a true eyelid ptosis is when your eyelid is actually lower and you can't fully open your eye. This is very, very rare. If it does happen, there are eye drops that we can prescribe to help it, but it will fade in time as well. Some of the more serious, rare side effects that you may hear of if you listen to the long commercials on TV are allergic reaction or swallowing or breathing difficulties. Now, these may sound scary, but we don't see these when we're using it cosmetically. These have mostly occurred in cases where they're using the products at much higher doses to treat medical conditions like muscle disorders. Now, who cannot get Botox? Of course, if you're pregnant or breastfeeding, I'm not going to treat you. We're going to wait till all of that is over. If you've had a hypersensitivity to the product in the past, then we would avoid treatment as well. If you have any infection or a rash over a treatment area, we need to wait until that heals before we can do the treatment. And then one other little one that's interesting is Dysport is actually made with a cow's milk protein. So if you have a true allergy to cow's milk protein, we're not going to use Dysport, we'll use a different brand product, and that would be totally safe for you. Lastly, if you have any neuromuscular conditions like myasthenia gravis, again, you can't do Botox. So let's talk about after your treatment. Of course, what we want to do is take it easy just to let that treatment take effect. So no exercise for the rest of the day, no heat like hot tubs or saunas for 24 hours. These can just increase inflammation, and so we don't want to do that. If you can avoid alcohol and NSAIDs like ibuprofen, that's best, just because these thin the blood a little bit, and so they always can increase your risk for bruising. And then you just want to take it easy, not have any laser, microneedling, facial massages for at least 48 hours. Now, your treatment is going to start to show up in about 2 to 4 days. So it takes a couple days for the effects of the product to really kick in. But your treatment is going to last for 3 to 4 months. Now, that's not that the full effect is actually going to last for 3 to 4 months. Your body starts to break down the product before then, so at around 3 to 4 months, it's probably going to be completely worn off. And just as a side note, your body just breaks down the product into proteins and it's cleared by your kidneys. So lastly, let's just talk about some Botox myths. I just want to debunk these for you and just set the record straight. So, first myth, Botox is permanent. No, like I mentioned, it's only going to last about 3 to 4 months, and then we do suggest coming in for retreatment. You do want to retreat your muscles before they become too active again, because once they do so, you're going to start creating those deeper lines when your muscle is able to contract. Second myth, Botox is only for women. Totally false. I have lots of guy clients and they love getting these treatments as well. Of course, guys can create lines on their forehead, here, around their eyes, so I highly recommend this treatment for men as well. Third myth, Botox makes you look frozen. So this is false in that it actually is injector dependent. So the more traditional way of injecting Botox was to make you look frozen and unnatural. But the modern touch is more of a light sprinkle, something that where you just look rejuvenated and refreshed and still can make your muscle movements and make your different animations. So I always go for a more natural approach where you still feel like yourself. We just want to keep everyone guessing. We don't want people to know that you've had Botox. You know, people should just think that you look more rested and more rejuvenated. Fourth myth, if you stop getting Botox, your wrinkles will be worse. So this is totally not true. If you stop getting Botox, you're just going to go back to your normal way of muscle movement of the face, and you're actually going to be better off than if you had never gotten Botox in the first place, because you've spent that time with your muscles relaxed where your skin has been nice and smooth. Last myth, fifth Botox myth, and that is Botox can be injected by anyone. And this is not true. So Botox is a medical procedure and it's not without its risks. And it really should be done by a licensed medical provider who's had advanced training in injectables. So I myself am a licensed physician assistant. I can practice in the state of Colorado, and I've gone to advanced trainings in both dermatology and plastic surgery. So I'd love you to come see me for a free consult. I do consultations here in our office. If you're not able to come see me though, make sure you're doing your research. Make sure you trust the person who's doing your Botox for you. And if you find someone who you love, I'm sure you're going to be going to them for the rest of your life. So If you have any questions about these treatments, please come in, come have a chat with me. Again, I do free consults, and I obviously love talking about Botox and other cosmetic treatments, so I'd love to see you here in the office.